Good morning, ladies and gentlemen. I'm so sorry that I can't be with you in person this morning, but I am in London thinking of you, and I have been thinking of you quite a great deal in the course of the last 6 to 9 months as you've been battling with your floods and the consequences of those floods, which I'm sure you measure in terms of the social, the emotional and the economic impact. My session this morning for you is going to focus on families with multiple needs, what we call high-risk families. And at times of crisis or challenge, the risks and the needs of our most vulnerable families, parents, carers, children and young people can of course be exacerbated. In the UK, as you know, we're facing our own period of challenge. We are in what is called a climate of austerity, and that really means that many of our services, whether they be public services or services provided by the voluntary and community sectors, are being reduced. And there are a number of consequences of the climate of austerity in the UK. That is, the number of vulnerable families are growing, and the needs of our most vulnerable are also growing because they are always hit disproportionately. The other consequence, of course, is the need to be able to target interventions effectively, making the best possible use of time, energy, resources and money have never been greater. So I'm going to talk to you first about some of the characteristics of families facing multiple difficulties and challenges, and then identify some of the high-level messages that we have found really make the difference to their outcomes. And just to remind you, C3O, the Centre for Excellence in Outcomes, and many of you will have heard me talk last year, does 3 things essentially. We bring together the best possible research and evidence, whether that be national evidence or international evidence, about what makes the difference to the lives and outcomes of families, children and young people. We draw out of that evidence the key messages about what works in order to inform the practice of both leaders, managers and frontline practitioners. But we also draw together really good examples of effective local practice, because what we have found, and I'm sure equally you have found it, I know you have from my visit last year to Queensland, often what's happening on the ground, local practice, is outstripping national and international research and evidence. But in judging what constitutes effective local practice, we set the bar very high, and we have 2 essential criteria. There must be evidence of sustained impact on outcomes, and there must be capability to scale up the local practice. Now, I know I'm going to be referring, as we go through this talk this morning, to local practice in England and the UK, but I hope very much that some of the findings will be equally transferable to your situation in Queensland. I'm sure they will. I'm sure they will. And of course, the other thing that we do in the UK through the C3O is actually provide practical hands-on support to make best use of our research findings and our local practice. But as we go through this morning, and I'm just really going to talk in headlines, so you'll have to forgive me, I'm going to refer to our research reviews, and I'm also going to identify a number of examples of local practice. Now, I'm hoping very much that the slides that I'm going to refer to as I go through this presentation, I hope that you'll have in hard copy. But I've been assured that as I go through this, we'll also be able to focus on the slides as well as on me delivering this presentation. So I hope you will not be disadvantaged by me talking to you from London to Queensland. So, first of all, let's have a quick look about what we mean by high risk. What are the triggers of concern, and why is it important? Well, it's obviously important because families with multiple needs and difficulties, challenges, are likely to experience poorer outcomes. Poorer outcomes both as children, young people, but also as adults. And we cannot afford to have an increasing number of children, young people or adults not able to participate fully in society or contribute to our economic well-being. So the cost to individuals is too high, but the cost to families, communities and the nation is also too high. So a very quick look about what we mean by the high risk factors for families. What are the triggers of concern? And they are listed on this particular slide. And I'm not going to read through them all. And again, as I said, you can refer to them in your pack. And it isn't also right to say that because you are a family or a family member experiencing one or two of these high risk factors, that automatically you will also have poorer outcomes. But what these triggers of concern show is that you have the potential, you are more likely to be at risk, and it also enables commissioners and providers of services to analyse where they may best target their resources, their energies, and to avoid complacency. If there are families that have a complexity of these triggers of concern, then they are families that may warrant support at some point in their lives. So I talked about our research reviews, and I'm going to very quickly draw on some key messages from a number of the research reviews that we've brought together in C4EO. Our families, parents and carers reviews, child poverty, children with disabilities, child protection, early years and early intervention. And last year I had the pleasure of talking with you about our work on early intervention, and I'm going to refer back to it as we go through this morning. But can I just say, I'm going to talk in headlines, but you will find these full research reviews on the C4EO website, along with all the examples of excellent local practice, validated practice. They are free and they are available. So anything I say to you today and you think you want to know more about, please go on the C4EO website and you'll see these research reviews set out in full. So I'm first going to look at some of the key messages that focus on our three research reviews drawn across our families, parents and carers theme. They are developing parent and family support strategies, supporting parental physical and mental health, and strengthening couple relationships by reducing family conflict and addressing domestic violence. So looking first at parenting and family support strategies. And as I go through these key messages, there will be no surprises to you, but it's perhaps just worth always reminding ourselves about those things that really do make the greatest difference. The first finding from that review is that it is essential that parents and carers are encouraged to make full use of services at the earliest opportunity, at particular points, at times of stress for them. And the majority of parents and carers and families actually prefer to have those services delivered for them at most local level, where they can access them through what we call our universal services. We've found that the take-up of specialist support services is much higher when they are delivered through health services, through our early year settings, which we of course, as you know, call children's centres, and schools, because support services for families in need need to be locally accessible, highly visible, but non-stigmatising. So they are best accessed through what we call the universal doorway. The other finding is that services that are provided through schools have been shown to really have the most significant impact on children's behaviour. Not just school-based services, but services provided by through health, youth offending services, and also specialist services such as domestic violence. Nearly all children self-evidently go to schools, but also parents and carers obviously are regular visitors. And services that are wrapped around schools and provided through them, again, visible, accessible, have shown to demonstrate long-term impact. And of course, as you, I'm sure, will all know in any case, the most effective services are multi-agency services, where services are working together in a coordinated way, wrapped around the needs of a whole family, where health services, school-based services, early years services, and the specialist services work together, sharing information, assessing need collectively with the child and family right at their heart, and then determining a joint plan for action, again with the family at their heart. Because families with multiple problems, multiple needs, those needs cannot be addressed by one institution or one service working in isolation or alone. And of course, the other key finding, again, which you will be very familiar with, is the most successful interventions are where parents, carers, children, young people themselves are involved in both assessing their own needs, but also in shaping the services that are delivered on their behalf. Turning now to mental and physical health. Now, your statistics in Queensland are actually very similar to ours in the UK. So just a few facts, and I'm sure some of you may look at these and think, well, that's not right. But these are facts that I've drawn from the Queensland Government analysis itself. So that between 29 and 35% of mental health service clients are mothers of children under 18. Exactly the same statistic as we have in the UK. The second statistic, which surprised me, is that where parents themselves have a disability, the rate of removal of children into the child protection system is estimated to be about 40 to 50%. Therefore, parents who have a disability appear to be particularly vulnerable. 1 in 5 adults in Queensland, again as in the UK, appear to have a mental health problem. And again, between 25 to 50% of those adults also have dependent children. And parents who are deemed to be responsible or may be at risk of harm towards their children, of that client group, around 47% have drug or alcohol problems and 19% have diagnosed mental health issues. And I suspect, as in the UK, and we have got a real paucity of mental health services, that probably is just a sort of a tip of the proverbial iceberg. So, addressing physical and mental health issues is obviously very important. So again, some headlines. What have we found? No surprises. Again, the separation of children's services from adult services can mean that addressing parents' mental health issues is a challenge. And again, all the findings are when services work together in a holistic way, where children's services and adult services work together with the family at their heart, then physical and mental health issues can be better addressed. A significant issue in the UK is that for many specialist services, the threshold to accessing specialist support services can be very high. And therefore, the findings are that we have to be able to provide services at local level, at low cost, that are much more immediately available without problems becoming so considerable that there is an automatic referral to a specialist service. So providing services at a lower level in the community, where parents feel that they have the confidence to access those services, then that can offset the need to refer to highly specialist services, and those barriers can be removed. Actually, interestingly, one of the findings in terms of persuading parents and carers who have mental and physical health issues is the use of peer volunteers, those members of the community who are trusted and who